Morning, everybody. Happy Thursday. Lots of people jumping in. And as always, I love to see your faces. And this one, I've got a few questions that were emailed to me, and I will answer them. And if that's it, then we'll just have the short one. Most of you should have seen that a new invite went out because it's due to popular demand. It's scheduled for an hour. Doesn't necessarily mean it'll be a whole hour. You don't have to stay for the whole hour, but if you can, happy to have you do that. The recordings will be out there. We've got lots of questions about renewals and open enrollment. So I will, again, we're going to talk a lot about that in September. So, and I have been, I've had a couple people ask me about doing a kind of how I do an appointment. So to kind of really do it, walk you through. So I'm going to have one of the meetings is just, I'm going to pretend you're all clients. That you're a client in my office, and I'm just going to kind of show you my process. It is not, I know sometimes that's just what you're missing. Like, I'm not saying you have to do it exactly like me, but it'll give you an idea of how I do it, how I stack, how I present it. Let them make the choice. Okay, lots of people coming in. This invite now goes over to over 200 people a week, so which is amazing to me. That's awesome. If I figure if half people sign up to watch, and then it looks like around 45 to 50 will end up looking at Zoom, we're doing pretty good. Give it a few more minutes as everybody's popping on. So today's session is about what you're kind of worried about, what's a fear, what your concerns are. The more you interact with me, the better this session will be. And remember, if you have a fear or a concern or maybe a little trepidation about something, somebody else does too. So don't think you're the only one, especially if you're new at this. You're not going to be the only one. So don't let that be a reason to, not participate. No problem, Joseph. All right, letting people in. I'm going to share a couple things here at the beginning, only because a lot of people have been asking about it, and it's easier to just tell you all at once. If you haven't heard about it, that's fine. If you want no more information, that's fine. There is a program going out. You're going to start seeing advertisements for it. So Octavio, we actually record all of these, and then I send it out. So you don't have to have your own recording. I record all of these. They go out to everybody who has requested to be a part of this group. So whether you are actually on it or not, and then I send out the link to YouTube. So you don't need to record it yourself. You'll be able to go there. If there's a specific reason you want it versus how I send it, you'll have to send me an email. All right. All right, we got about 57. We're at 3 minutes past. So I'm going to tell you about a program that you might have heard about. If you're interested, I'm happy to share it. If you're not, that's fine. As always, this weekly thing is for anybody across the country. There's no stipulations. You don't have to be part of an FMO or buy downline or take my client. You don't have to do any of that. This is just for education. So there is a program out there now for Walmart. It's a combination of Walmart and Allstate. They have joined together to start doing under 65. It is They did a few last year, some test pilots at some different Walmarts, and it was very successful. Well, with the whole rollback of Medicaid, there are so many people who don't know where to go. They don't know what to do. So Walmart and Allstate decided, hey, let's have people in Walmart. Very similar to the Medicare thing. But unlike Medicare, there's not a lot of requirements, right? We don't have to have everybody's permission and all that stuff. So there is an FMO that is connected. It's the only FMO that's connected with it, called North American Insurance Services, that if you have two ACA contracts and your Allstate contract with them, you can go to Walmart. So if you are interested in that and have not talked to me, I can tell you, I'm going to put the link in the chat so that you can talk to basically the recruiters. They don't stipulate what two ACA carriers. They're not requiring it, if you go, well, hey, I've never sold Oscar, I'll give you Oscar. That's fine. It doesn't really matter. But in order to get the Walmart, and it's exclusively your Walmart, there's nobody else there. Walmart's actually going to advertise. They're going to put signs up. They're going to have a little kiosk for you. And it's you. It's not you representing Walmart. It's you representing yourself. This will be one of the fastest ways to grow your book of business. So if you're brand new, or you were maybe you were part of a downline system where you were kind of bound by them and now you're going independent, this will grow your business faster than anything I know. There are so many people walking around who have no idea what to do. They don't know where to go. They lost their insurance. And instead of maybe researching it, maybe they did, and they saw there's like, oh, there's 300, things out there, and they're overwhelmed. You can become the expert. So if you're interested, I'm going to put the link right now. Last couple of people joining, to talk to, it's be a broker. You can talk to one of the three people on that screen. You can actually set them up, and they can tell you about the details. And again, the requirement is to have your Allstate and two ACA contracts under North American. That's it. The Medicare is different. So the Medicare, Walmart contracted with somebody, I don't know who it is, and it's Humana only. And it's a different FMO, it's a different company. There are some Walmarts that will, about 1,500 last year, that will have a Medicare dedicated person, but they're only selling Humana. If you want to sit there and there is a Medicare person there, all right, don't steal their business. Don't talk about it. But if somebody walks up to you and says, hey, can you help me with my Medicare? You can say yes, but do not advertise it, okay? There's all kinds of restrictions around Medicare. You don't need to advertise it. You're there to sell health insurance. People will ask you. So you don't need to put a sign out that says Medicare. You can, kind of the suggestion we're saying is, yes, I would love to help you with Medicare. Let's set up an appointment. Get their number, get them on your calendar right then to talk to them at a different time, not at Walmart. So it's not, you can do both, but if you're looking to grow your ACA business, this is by far one of the fastest things I can think of. Spent about 2 weeks sitting there consistently, and this is from the people who did it last year. They said after those first 2 weeks, it was pretty much just consistent. People coming in, talking. It took 2 weeks for the people to go, who is this person, right? Who are they? And then start thinking about coming to see you. So I put that in there, the link down there. So if you've already done it, don't worry about it. If you don't have any interest, don't worry about it. But if you are, I'm throwing this out there because I think this is a great opportunity for new people. All right, so now topic of today's discussion is really, what are you afraid of? What's stressing you out? So I did get a few people that sent me some emails, so I'm going to go through theirs, and then you can start thinking if you've got something. Feel free at that point to unmute yourself and share what you're thinking, and we'll go from there. So one of the questions was really the fear is tax time, getting really stressed out that the clients are going to have to pay a lot of money back. Now, there was a time that I told clients, under no circumstances can you go over your income. Absolutely not, because there was a cliff. You qualified at this side and you made $10 too much, and now you're no longer qualified. And they would have to pay it all back, thousands of dollars. There were people that had $23,000 that they had to pay back because they were getting tax credits that were close to $2,000 a month. That stressed me out. I'm going to tell you, that was stressful, right? I'm telling them, like, do not go over. Whatever you do, if you think you are, you call me right away. We don't have to worry about that. If they tell you that they make 50,000 and then they end up making 100,000, yeah, they're going to have to pay some tax money back, but that's not on you, right? If you tell them, I'm putting your income at 50, if you make more, you're going to owe some money back. If you make less, you might get some money back. And it's a dime for a dime, right? If the IRS paid 10 cents more than they wanted to, they want their 10 cents back. But if you paid 10 cents too much, you're going to get your 10 cents back. So you can show them. I mean, I personally like them to see the screen, but I can say, for an example, you told me you're making, 32,000. And your tax credit is $400. Let me show you what happens if you make 52. Well, now your tax credit's only $300. So if you put in 32 and you make 52, you're going to have to pay that difference back. $100 times 12, 1,200. Just a very simple example of how it'll affect them. And then I do tell all of my clients, if it's less than $1,000, you don't need to call me. Because ironically, it's the people who are, they don't have a lot of money. And they, oh no, I just got a raise and I'm going to make $100 too more than what I told you. And then they call you and they're panicking because they don't want to have to pay it back. And then I'm like, we're talking $3. You don't panic. Your $100, you might have to pay $3 back. So I tell them, unless it's going to be more than $1,000, you don't need to call me. The difference that you'll have to pay back is pretty minimal. And most don't even know it. It comes off of their tax return. So don't stress out too much that they're going to have to pay back thousands of dollars. If they do, it's because it's on them, right? They took out 10,000 out of their IRA and didn't tell you. Well, okay, you took 10,000 out of a taxable account. So don't get too stressed out. One of the questions was they'd like to hear how I perform for renewals because we have this big Medicare book of business, right? Renewals at the same time, AEP and OEP. And they want to know how, and it's overlapping. The challenge is fitting everyone into the schedule. So do I send out automated texts or emails? Do I review every client or only those who are unhappy? Well, now here's the difference between ACA and Medicare. You don't have to contact your Medicare people, right? I mean, I'm not saying never touch them again, but if they are happy, they can just keep their plan unless the plan is changed. With ACA, you kind of need to touch them. You just do. There's more customer service on the ACA side than Medicare. So I prep them during the appointment, which kind of goes into the second question that somebody said. Most of my ACA clients will not get back to me despite multiple attempts on your part to review their coverage during OEP. I assume they're happy with their plan because I do state if nothing has changed and they are happy, simply to let me know. And I believe they take that as I don't have to do anything. So you're going back to the Medicare thought. If you're happy, nothing's changed. But guess what? ACA changes every year. It doesn't matter if they're happy, the marketplace changes. So I do send out texts, voicemails, and emails to everybody in my ACA book of business. I start doing that in October. And a little bit in September, just kind of a, hey, it's coming. But October is when that happens. But I prepped them, here's the thing, during your first appointment. During the first appointment, we start going through it. I show them the application, or I tell them I'm filling out your application and, and I'm verifying the information I'm putting in there. And then when I get to the end, so the attestations, it says, do you want us to renew? And it talks about those attestations. That's your time to tell them, all right, the system's going to automatically renew you, but you don't want to do that. You want to tell them your plan may not exist. Your plan may be twice as expensive. Your income will not be correct. Even if you only collect Social Security, your Social Security goes up. Yes, Mary.
Why do we not want to let the system automatically renew them?
Because I'm just telling you, it changes. The tax credit changes. The income changes. Plans change, right? Every year the plans are slightly different. And maybe the plan they're in there's another plan for $1. or maybe a buck less. That's actually better. Now, it can happen, but their income will always change. Even unless they only, there's a few, right? I'm living off a pension, or my withdrawal from IRA. But then they will tell you nothing's changed. We have clients that were asked that 3 years in a row, nothing's changed, nothing's changed. They collect unemployment or Social Security. They've had 3 raises, but their income hasn't changed in 3 years. So then at tax time, they're paying in unnecessarily because they never went up and updated their income. But I'm prepping them to do it themselves. So first appointment, I say, here's this thing. Yes, it says they'll automatically renew you, but you don't want that. The system's not smart. Your plan may change. And if your plan is gone, they're going to put you in a plan that may not even cover your doctors. Your income's going to change. So I'm asking you, as your agent, please help me. I filled everything out for you. It's already done. All I'm asking you to do now is you're going to get a renewal link. I want you to click that and make sure your personal information has not changed. And then I make a joke that you didn't get down, that you haven't changed your birthday to get younger. And they kind of laugh, It's like, your stuff's already there. I think, they're intimidated because they're like, I'm going to mess something up. Well, hey, you're not going to mess anything up. It's already there. I just want you to make sure your address is the same, the income's the same, you have the same household people. And they go, oh, okay, I can do that. I would say 80 to 90% of your clients will go, I can do that, because you're asking them to help you. Then I say, if the same plan you are in right now is still there and is affordable, you absolutely can just click the submit button. But if you get to the end of your application and you're like, oh no, look at all these options, that's fine too. Send me an email and I will tell you the best options for you. Then, because now they've done the hard part. They've just, so now you go in, because every time somebody touches an application and enrolls, you get an email. Now, I have less. I used to have 900 individuals on the marketplace, which is about 600 applications. I now have an assistant. I don't have quite that much. Sam is awesome. She helps me a lot. So I personally, what I'm doing is I'm having her open all of those emails that come from Health Sherpa. And then she kind of checks them out and she, okay, this person's completely filled out the application and they enrolled. I will look at what they do at night. I just kind of sit at home, glass of wine, and I look to see what people have done. And if they're in a good plan, send them a quick email. Hey, thanks, Bob. Looks like you filled out your application and you enrolled for such and such plan. It's a great plan. You're all set. Or, hey, Bob, I see you filled out your application, but you signed up for a different plan than normal. You picked a $7,000 deductible plan. They probably picked the cheapest. And I go, and last year you had the $0 plan, and it's only, and I look for it, and it's only $10 difference. Would you like me to just switch it for you? They always say yes. Oh, thank goodness. Oh yeah, I just picked the cheap one, or I wasn't sure. So it's pretty quick. I mean, that whole process is 15 minutes. Maybe, it takes you longer to get the email. I have custom or templated emails because I tend to say the same thing over and over. You're all set. Or, hey, Bob, I see you filled out your application. Do you need help picking a plan? Based on the information you've given me before, here's the 3, and I'll send them a link. Or here's your current plan. It's still really good. Unless something's changed with your doctors, I recommend just doing that. You will have about 10%. If I can keep it at 10%, no matter how many individuals I get, if I can keep it at 10% that are actually wanting to come into my office, call me on the phone, or talk to me, that's not so bad, right? That 10% is the loyal guys that trust you, but they also are a little bit afraid. In our business, I've noticed it typically is the people it's their first renewal. So they're really worried. It's the first renewal. They want to make sure. It's a lot less once they've gone through one renewal. Then they're like, okay, that wasn't so bad. That wasn't a big deal. Now, I decided, I think it was 3 years ago, I personally have a class. I have a class the last week of October, and I invite every client to come. I have them in person. I have them Zoom, whatever this is just how I do it. And I go over the application. I just walk them through. If you've been on my YouTube channel, you can see it. I just walk them right through step by step by step by step. And then I talk about the plans. So the people that are coming to see me in person, I mean, I have a county that's pretty much 90% of my business is in one county. I tell them, if you're in Sheboygan County, here's the plans you want to look at if this is your network. If you're, and then I do one for each county of the clients that we have. I make Zooms. Again, if you want to look at the way I have my Zoom set up, you can. I will break out one county and go, all right, Manitowoc County, here's the plans to look at. It's really short because I'm only sending it to Manitowoc. And then I go, Milwaukee County, here's what you're looking at. And I show them how to like narrow it down. And that has helped. And we send that link out to everybody. So that's kind of how we've handled it. The more we can get them to do it, but we're also showing we're the expert. It does mean the last week of October is a little bit insane for me because, you know, I don't know when the plans are coming out. There was a year, I think we got them on December 3rd or October 30th, 2 days before open enrollment. It was like, oh my goodness. And of course, they get them, the clients get that the same time you do. Unlike Medicare, right? Medicare gives it to you ahead of time. You can actually look at it. Heaven forbid they give that to us. but it'll happen. It will happen someday. So as soon as those plans are available, I'm looking at them. But I'm a Wisconsin agent. I am not Wisconsin and Florida. I don't do other states. I really don't, because I'm the expert of my state. Somebody asked me the other day, how do you know all these plans so well? I said, because I only know my state. So those of you who do lots of other states, God bless you. I have no idea how you do it because there's so many nuances. I only do Wisconsin, but you know, Joshua, who's on here knows it, John, we all know our state. We know our carriers. We know the way the plans are. Open enrollment comes, we get those stuff, and then we kind of pass them out. I go, all right, Josh, you look at Prevea, and then I'm looking at Common Ground, and we kind of read the summary of benefits to see if there's anything odd that's changed. We noticed with Prevea that they changed their chiropractic coverage to only acute, not preventative and acute. Oh, well, that was a change. So then we would let people that were enrolling that, just so you know, we kind of pointed that out. They look at that. We look at urgent care out of the state. Molina doesn't cover urgent care out of the state. I don't understand. But all the other carriers do. So we can point that out, right? So when you read the summary of benefits briefly, they're not going to change. Now, Blue Cross being weird in some states, you know, Blue Cross L and S, yes, you're going to have to look at those differences. But if it's a Humana plan summary of benefits and it only covers chiropractic acute 1, it's going to say that in all of them, you know, so it's not like you have to read the summary benefits of every single plan. It is going to be less this year because the Fed's regulation is making them offer less because it was a little overwhelming. I mean, in Milwaukee County, there's something like 57 plan options. Of course, people are going, I don't know, or they're picking the absolute cheapest thing and it's probably the worst thing. And for just a few bucks more, they could get something better. So that's how I do it. And then I text everybody. Somebody said, when they do not bother to contact you, how do I actively go in and enroll them in the same plan rather than allowing them to auto? So the new CMS consent form, if you look at it, says you now have permission to do that. I typically wait to the kind of the last week in October or December, or the after open enrollment, December 16th. I go and I look and I see, all right, who hasn't renewed, who hasn't touched it. And I keep pretty good notes on my clients. And if Susie hasn't done it, I know what she's, you know, I know what she's like. I will email her saying, hey, Susie, I see you didn't do this. I went in and made sure the same plan is still the best one and it looks like it is. Or, hey, Susie, there's these other options. And let, you know, and email them saying I'm doing it. I have your permission, but you better have their permission, right? If you haven't gotten that permission beforehand, you got to get it this year. And we've always asked for permission. We kind of have that signature. The problem with the new CMS regulations is I didn't have it listed how to remove that consent the way that they're saying. So we are going to do a very large mass text saying, due to the government's regulations, and yes, We know you've given us permission, but now we need it officially in this form. And I'm sending it out to people. There are two people you can blame for all these weird things, the IRS and the government. And everybody will go, yeah, we blame the IRS for everything. Let me tell you. Oh, this is so expensive. Yeah, you know, that IRS. Um, well, they're going to take my money away. Well, you know, that IRS. So IRS is kind of the bully that we can all agree to hate, right? Don't get political. Don't ever get political. It doesn't matter which president you like, hate. Doesn't matter what they like or hate. If they bring it up, you can just go, yep, politics. All right, insurance, and get back to it. Don't blame a specific Democrat, Republican, independents. Don't get into that conversation. Just government and the IRS. So the other question was, I can read the plans. I'm aware of what options to send them for their choosing. What I don't know or understand are the finer, more detailed processes. So I'm not exactly sure what that is meant. I don't remember who asked that question. So if you're on here, let me know. If you mean how to present it or how to send it to them, I'm not sure what you meant by the details. So it looks like I have a whole bunch of new messages. So Jill was just asking, are they going to send, is Allstate going to send materials to the booth? So we have materials to help promote their product. You can ask for the materials. They will send it to you if you would like. They are happy to send it, but I don't think they're just going to do it just in case. So, and if anybody who just logged in doesn't know what that means, it's something at the beginning. There's a Walmart program where you can sit at Walmart. Are you only able to sell this in Walmart? Sell what? You can sell anything. Okay. There's no restrictions. There's no requirement. Let's just say you signed up for Oscar and Ambetter through North American and United Healthcare is a better option. Give them United Healthcare. There is no requirements. They're not forcing you to sell Allstate, but I will tell you, if you don't play by the rules, if you don't sell any Allstate throughout the entire Walmart process, they're probably not going to let you have that store, right? I mean, they're the ones who are footing a lot of the bill. So make sure you look at the Allstate. They have a dental plan that is phenomenal. If you have dentists in the area, oh my goodness, their network plan, it's amazing. So you can look at the Allstate. It's not required. Will there be a separate setup than the Medicare agents? Yep, it's completely different. They're not connected at all. And Catherine said she worked at Walmart Medicare and got lots of interest for the ACA. Yep, and you weren't even purposely doing it. So is there additional cost to be in the Walmart? Nope, it is free. So this is a free opportunity. That's why I said I'm so excited by this. It's not going to be free forever. I think this will start, a year or two from now. They might start charging, but right now it's free to sit there. It is the easiest way that you can learn and build a book of business. You want to learn more about QSERA, where an employer can pay towards the employee plan and select a plan from the marketplace. Yep, QSERA is a whole separate entity. I actually have one of the classes that I created is just about ICHRA and QSERA. That's a whole nother segment to really understand it and to understand it correctly, when to do it, when not to do it. So if you really want more information on that, I would recommend you go to my website for the class. As I've mentioned before, there's a charge, but I give you 50% off. Everybody's in here. A single class would be $75, and I go into great detail about the ICHRA and QSERA. There is a time and place, and I'm actually going to be, I met a new company that I'm really excited about to help with small group and ICHRA situations. And as soon as I get the full details and more information from them, I'm going to add that to that module about ICHRA. Jennifer, you said, is that for next year or the fee applies to this year? Not sure what fee you meant. So Jennifer Clark. Can you talk about geofencing and tagging as part of my marketing? So I have used geofencing and right now, so geofencing is the creepy information where you show up at the dentist office and suddenly you're getting all these ads about a dentist. You walk into the state fair and suddenly you're walking past a booth of cows and you're getting ads about cows. Okay, so geofencing is a very focused marketing to a specific area. I am using it right now for the Medicaid rollback, and I've used posters. So there you go. I am targeting Milwaukee because that is not a place that I advertise. I'm in small town north of Milwaukee. I don't I don't typically advertise. So I said, all right, let's do geofencing in Milwaukee so I can track it, right? Then I would know it was specifically from geofencing. So we are geofencing libraries, we're geofencing bus stations. Somebody's trying to call me, I think. Um, and so we've got, trying to think where else the geofencing was. Job centers. So there's some very specific places that I have worked with for geofencing, and we have seen an uptick in Milwaukee people calling us. And that's 100% because of geofencing. Don't advertise. I don't have the radio station down there. I don't have anything. So it was really easy. And then I have met with them since we started the geofencing. The company I use is great because then they'll show you. They'll go, hey, look, this is where people are clicking on your button and coming to your website. They actually follow all of that. Now, Milwaukee people are not walking into my office, but they can actually track that too. So if the phone in the Milwaukee library clicked on my website and then walked into my office, they will actually show me that because I've used geofencing locally before. So I do like geofencing because it's very targeted. You can target a neighborhood. You know, there's a neighborhood in general, a whole large area that needs help. You can do that. Or maybe you want high-end clients. You can do geofencing for high-end houses and it'll show up on their TV, right? When you're watching Hulu, you have to watch those commercials. That's what that's coming from. And it goes right to their phone. So geofencing is very interesting. I do like radio for my local market because people just start hearing my voice over and over and over. I've been doing radio now. I think we're going on 3 years and I hear it all the time. Well, my friend heard you. I heard you. And believe it or not, people still listen to the radio. I'm not one of them. I typically listen to my own music. I actually have yet to hear my own commercial. So, and I'm on 4 radio stations, a sports one, talk radio, a country station, and the sports one is sometimes hard rock. And then they say the mom station. So I don't know what that is, but I'm on 4 stations. But again, I'm very local. I'm not trying to do it in Texas. And then I've put posters out. And if I'm going somewhere at the grocery store, I'm sticking that up there. I'm specifically doing it for the rollback of the Medicaid. And I'm about to go back down to Madison, Wisconsin. It's about 2 hours from me. So again, I don't advertise a lot down there, but I put posters up in all these grocery stores. On my website at nextstep-insurance.com, as soon as you log on, a little thing pops up and says, how did you hear about us? Somebody wrote other, and they wrote poster at the grocery store. And I was like, woohoo, it worked. So somebody took the time to actually write how they found me. And then secondly, the second biggest influx besides referrals is actually my truck. I have my truck wrapped. It's amazing to me how many clients I've gotten from my truck. So when my husband drives my truck, I'm always like, please be nice. Don't cut people off. This is my business. So that's just how I do my marketing. So Arlene, when would you or the insured talk about their doctors? So you have to do your style. My brother is a prepper. He likes to do it the night before the appointments. He looks up their prescriptions. Now, again, this is partly why being the local person, knowing my plans, I don't have to look up doctors hardly ever anymore. If they say Aurora doctor, well, then I know this is Aurora, this is the network. If they say a Prevea, I just know. If they say, Freighter, I know. Rarely do I actually have to look up a doctor. That's because I know my system so well. Their prescriptions, you look up a prescriptions for a while, you start seeing the generics, right? You're like, oh, hey, that's a statin, that's a, it's the oddball ones. They're like, oh, what's that? Those oddball ones, eventually you'll see them multiple times too. So Joshua looks at them ahead of time. Never use Health Sherpa ever to look up prescriptions and doctors. It's not correct. Neither is Insura. All of those enrollment platforms get their information from one source, healthcare.gov. And healthcare.gov has not had that working correctly ever. The insurance carriers send them the information, and I don't know what happens. So always go into the, when you're looking at the benefits where it says find the doctors and it takes you directly to the carrier's website and the prescriptions. So if you have a prescription, you're like, oh, I've never even seen that one before. Always look directly. Now I'm fast, I'm a really fast typer. And because I've been doing this a long time, I kind of do it during the appointment, but that's me, that's my style. My brother doesn't do that. He's got a form, he's got the carriers, plus he's got what does GoodRx give you, and he gives that to them in their appointment. So he's looking the night before. So that's kind of on you how you want to do it. All right. And Tina said, if they pick their own plan, how do you stay the agent of record? So I send them the link from Health Sherpa. I do a mass on October 30th or 31st, 30th, maybe November 1st. I click the button on Health Sherpa that sends it to everybody, and I send it out. And I send a text message the same day saying, I am sending you the renewal link. If you don't see it in your inbox, check your spam. So if they click on that, you're still the agent of record. Now, occasionally, what has happened, I'm suddenly not the agent of record. It's really weird. This person's been my client for years. I will figure out who the NPN is, and it sometimes is a Health Sherpa agent. George Stephanopoulos. That's not his name, but it kind of looks like that. So if you've ever done this, you'll be like, who's this George person? Well, when you look him and his NPN up, it turns out he's, some CEO at Health Sherpa. That does typically mean that they either didn't use your link. They just went to Health Sherpa. Everybody can go to healthsherpa.com and enroll themselves. And the system doesn't say, hey, we see you're already in the system under Chris. No, it doesn't. It just puts them under a Health Sherpa agent. If you email Sherpa, you know what they say? Oh, just redo it. Just redo it and attach yourself. So I now, every time I see that it's a Health Sherpa agent, like I said, George Stephanopoulos, I just know, okay, this was just a system. My client is not trying to kick me off. They have no idea how this system works. I go in there, I just redo it. And then that's also when I'm sending them that email saying, hey, looks like you did it. Great, everything's set. If they call healthcare.gov, healthcare.gov does not remove it. Now, their system's glitchy, which is why we don't want people to call healthcare.gov, but it doesn't remove it. So if you see that your client has no agent of record, that just means it just wasn't an assignment. Call them, hey, just making sure you still want me to be your agent. Yeah. Okay. So if they send it from your link, you'll still be the agent of record. My process of how I'm going to do it, Jill, and the link, I'm going to show you, I'm going to make a PowerPoint. I'm going to walk you through it so you'll see exactly what I'm doing. And then of course that'll be recorded, go out. So as best as I can, I will. And you take what I do and make it yours. So Sharon says, if you are in a state that did not expand Medicaid like Texas, the minimum income to get a subsidy every year goes up. If their income on the application is the lowest amount, yeah, it does go up. You said if they just let the application roll, they could fall under the threshold and now they have to pay back all the subsidies. Well, first of all, you never have to pay back all the subsidies if your income's too low, right? Never. Do you really think the IRS is going to say somebody who makes 14,000 gets 100% of the tax credit and somebody who makes 13,000 doesn't? It doesn't make any difference to the IRS. So if your income is too low, you will not pay the tax credit back. I don't know where that rumor started. You have to pay back if you made more, not if you made less. Heck, if you say I made 50,000 and you make 14, you're going to get all your premium back, that just about, right? You don't have to pay back if you make less. Now, every year, the maximum, that 100,000, that 100% of federal poverty level does go up. You are correct. In fact, next year it's going up by like $1,000. It's a pretty big jump. It's the biggest jump I've seen. So I do get in the habit, if somebody is on that lower, maybe doesn't make enough, they make 14,000 or they make 13,000, go ahead and keep them in the 100% to 150% above the federal poverty level and just put them at 15,000 so that the next year's renewal, they're still under. Because what can happen is if their income's too low, you put them right at the threshold, right? You said 14,000. Well, next year it's like 14,500. And your client just goes in there and updates They are completely unaware of how this whole system works. It's going to say, oh, you qualify for Medicaid, and it's going to send them to Texas Medicaid, and Texas Medicaid is going to laugh. Ha ha ha. Sorry, you're a dude. You don't get this. You're not a pregnant baby or a pregnant woman. You're not an infant. So put it up a little bit higher so that when that renewal happens, they don't lose it just because they're actually doing what you asked, which is to update their application. Rosalind says, I noticed in Health Sherpa towards the end of the enrollment that they are requesting consent. Yeah, the authorization. 2 questions. Where do we get this form, and are we uploading it to the clients in Health Sherpa? I'm not. I don't want them to have it. I think they're putting it there for people who don't have like a CRM system. I'm not sure why they're asking for it, to tell you the truth. I don't want them to have it. So I say that I have it, and I do. I sent out we send out our thing before the appointment asking for consent. Now, if they're coming in for a quote, maybe they haven't actually signed it. Okay, I can show you quotes, but if you haven't signed that consent form, I cannot enroll you. Okay, most of them are going to go, oh, sure. And then I send it. We use Form Doctor. So far, that is working really awesome. It's quick, it's easy. They're sitting in my office, they're at home. I send it to them, and they can just physically sign it on their phone and hit submit. So in our office, if they haven't signed the consent form for that first appointment, we're telling them, I can show you a quote. And then they go, yeah, let's do it. And then I say, all right, I need your consent. You didn't sign the consent form, government regulation, just to protect you and me. Oh, okay. So then I can send it, or I resend it, because we do send it to everybody. If they're in my office, we have a piece of paper. Please sign this. We haven't had anybody push back on that. And heck, there's a whole lot more paperwork with Medicare than this. If you want to upload it to Health Sherpa, you can. In theory, Health Sherpa, when people are doing it themselves, Health Sherpa is getting a consent form. That's what they said. Now, whether we get to see it or not, I don't know. I've heard that we won't see it. So, but they're still figuring this out too. Remember, Health Sherpa found out about this the same time we did. They have to completely redo their whole website. Their website is connected to healthcare.gov, which is ancient, antiquated, old, and doesn't work for crap. So when anytime Health Sherpa does things that's more in our modern technology, remember they're working with 1998 technology. So it can take a bit. So give Health Sherpa a little bit of a break. They're trying to help do this as well. They're trying to do what's right by agents, but I don't know what that means. And Melissa, you said the 50% off coupon. Yes, I will put it down there. It's capital NEWAGENT. That's new agent. That is my 50% off coupon for anybody that wants to go to my website and look at look at my classes. If you haven't seen my class, I can send that link in there as well. Feel free to take, I have them as individual classes. I've had people take just the advanced because, hey, I've been selling ACA for a long time. Great. You don't need the basics. If you just started, I have real basics. You can buy individual classes for all of them. So I will put that link in there on the website, or the website in here as well, right next to the coupon. If you take no other class, the class that I highly recommend is my CSR class. That's the one that I really, I'm very proud of that one, having you understand how the CSRs work. All right, let me go back to questions. Who do I use for geofencing? I use a company that is across the entire country. I can send you their information. I've sent it out to previous people. His contact, I will pull it up and put it in there as well. They are great to work with. I will say they're very transparent. They will work with you very much so on how the geofencing works. So oh, my system is being really weird. What are we doing? Oh, there we go. They have been, I like how open they are. So I like how much they're transparent. They will try something, and if it's not working, they're going to go, guess what? That one's not working. And I have been a bit of a test subject because I did this first, and they have been wonderful. So let me get you radio. So they actually own a radio. They own many, many, many radios, but it's a radio and marketing and advertising company. So his name is Steve Stoughton, about the friendliest person you could ever meet. He actually will give you his mobile number and his email. So I just put it in there, Steve Stoughton. That's his phone number, and then his email. Put that too, because it's it says Midwest Advertising, but they do the entire country, including some places overseas. Not that you guys are going to be working overseas for ACA. Right. Could we see my poster again? Actually, let me give it to you next week because I'm redoing it from feedback from the state, and I'd rather you see what they have done. So I will show that to you next week. So just remind me, Joseph, or not Joseph, Patricia next week, because I'm completely redoing it. Is my truck wrapped or do I have magnetic signs? It's wrapped. The magnetic signs, I think, don't have as much traction. Maybe they do, but I got it wrapped, which was great because guess what? Tax deduction on everything related to my car. The payment of the car, the wrap, all the mileage, because I'm constantly advertising, and it shows a commitment. So, and ironically, my gray truck looks better now. So I do tend to drive very fast. So I always worried that somebody's going to call and say, hey, I saw next step, whoever owns that, whoever's in that truck was driving too fast, but nobody's called me out on it yet. Arlene, you said you were talking about the renewal practices, the doctors come and go between plans. I actually don't see that. They don't go from one network in your area to a different network, at least for me. They tend to go to a different state. Well, you're not going to get cross coverage outside of, I think, Oscar and Ambetter. I think that's the only carriers that I know that cover multiple states. So Blue Cross of Tennessee does not cover Blue Cross of Arkansas. Just so you all know, Blue Crosses, while they are in every state, is a franchise. They are independent. The states are all independent. They do not cross. So don't sell a Blue Cross in one state thinking they're going to get covered in the other state. So somebody just says iPhone. You said you're new to the ACA world, wondering if there's a step-by-step process like for you. And yes, that would be the class that I just put the link. It's a step-by-step. I mean, I literally walk you from the very beginning, CMS, and how it works and why the system is what it is. I'm very much a believer of understanding why, so that you can then adjust. As things happen, you can go, oh, I know why this is happening, because you know the why. So that class will walk you through it. How do you change the agent of record if my system is being weird. If you're not calling healthcare.gov. Oh, please never call healthcare.gov. Seriously, never, 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 never. Only reason to call healthcare.gov is if you have to fix something in the past. You do it on Health Sherpa. You hit update application, you run it through, you pick the new plan, or pick the same plan, just pick it again, and then now you are the agent of record. It's as simple as that. That will probably change. That might even be the first thing they significantly change. But right now, it's simply opening the application, running the application through, and walk it all the way through application, and then enrolling in the plan. And now you're the agent of record. Joseph says, please provide advice for new agents working solo on how to keep up with all the information, client policies, data. And I think somebody else even asked, what CRM am I using? You got to get a CRM. You have to get something that's keeping it. Now, I don't know anything about the CRM except what I've heard other agents say. It's called less annoying CRM. It's very inexpensive. So if money's really, really tight, that one's, I think some, swear, but don't hold me to it, that somebody said it was like 15 bucks a month. So, I mean, like really, really, really inexpensive. Right. Get something like that that you can put all your data in. I personally use Agency Block. We did Agency Block because it kept track of commissions and because I have different agents. If it's just you, you don't necessarily have to keep track of it because it's not exactly an easy, it's kind of cumbersome. There is a new CRM that are new to me that I heard of that honestly, if I was doing this by myself, I would get it. It's called Agent CRM. Rosalind Scott, I'm telling you, that dude is the biggest geek, IT geek. I love him, right? He's such a nerd. He was geeking out over all the AI stuff. He is putting in some AI stuff that's pretty phenomenal. Thankfully, yay, I asked him, he works with Agency Block. So I'm going to get some of his automated stuff. As much automation as you can get. This is the time to do it. AI is not going to take your job away, but an agent who has AI is going to take your job away if you're not keeping up. The automated systems make your life easier. So Agent CRM, I was like, Rosalind, good. Is it a good one? You enjoy it? Yeah. So he's very, yeah, you can look him up, Agent CRM. If I was doing it right now, I would take that. But I do have Agency Block and he does have programming that I can mix with that. So he may be able to do it some other CRMs that you have. I've used Smart Office. I did like Smart Office, but there's a lot to it. And if you don't need all of it, maybe it's too much. There's also Smart Office, very inexpensive. It's $100 a month and you can have like 100 other people have usernames and passwords in your CRM. So there's lots of them and that's how you're going to keep track of it. And I don't know about other CRMs, though I would guess they'd be similar. At the end of open enrollment on Health Sherpa, you can download a document, an Excel document or CSV one, and we send that to Agency Block and they upload it for us. One giant mass. Here's the person, here's their plan, here's their start date. So we're not typing individually each time. Arlene, is there a consent form that you can send us? Yes, I sent that in previous ones. It's exactly the consent form that CMS is said. I use it for Form Doctor, and then I made a paper one for those who are coming in. If you're going to be part of the Walmart program, you're going to want a paper doc just sitting right there so they can sign it. You know, if you can get them to sign, and we will have a best practice for Walmart people on what to do to kind of, you know, best practices while you're in the store. Arlene, send me an email and I will send it to you. It's Chris at nextstep-insurance.com. It should also be on the invite that I have. Just send me an email saying, you know, send me the consent forms, please, and I will send that out. Because I don't want to put that on this renewal. Scroll back up. What CRM? Yep, that's what I use is Agency Block. Scott, can we talk, any way you can talk about the Walmart All-State Association again? Yes. So, great. Anybody who, because this was at the beginning, there is an FMO, North American Insurance Services. They're a great little company. They have they're the exclusive HMO or FMO to have an access to Walmart. There is a company, HST. I'm sure some of you are familiar with them. They are actually owned by Allstate. They are also in the mix getting these Walmart stores, but they are a LOA agency and North American is a FMO. They are letting anybody who contracts under them at minimum 2 ACA contracts and your Allstate contract. And then you get to go to Walmart and you're there minimum 20 hours. You do have to commit to 20 hours, but it's your 20 hours or more out there, and you get to sit there anytime during open enrollment. You can actually do that all year long. Now it's in combination with Allstate. So while they are not requiring you to sell Allstate, as I mentioned, if you don't play by the rules and you sell nothing of Allstate, they're probably not going to let you come back. I mean, Walmart's charging Allstate to foot some of the bills. So they're going to put signage up. Every store that's assigned to an agent, Walmart takes about a month to get all the signage in there. They start doing advertising. They let the manager know you're coming and stuff like that. So I will put it down there again in the chat. If you're interested in that, there are 3 very excited people at North American, Alan, Amy, and Brenton, who are extremely happy to help walk you through that, send you contracting, and it's any two ACA and Allstate. See what else I'm missing. Tina says they've been going through my classes. They're in depth and fantastic. Well, thank you, Tina. I worked really hard on those classes, so I'm glad and I've had very good feedback from people. Thank you for sharing your awesome information. You're welcome, Caroline. I'm really happy to help anybody. Catherine, Blue Cross of Florida PPO does work in other states. Well, it's a PPO. It may work in another state, but it's not in network. So I would not sell, personally, I don't sell PPOs. We have a couple of them. A PPO only means you can go out of the network and there'll be some payment. Maybe. You have to look at the out-of-network deductible. In my state, the two PPOs have a $10,000 deductible and no unlimited max out of pocket. So you go to the network, you're covered. Are you? You have to have a $10,000 bill before they even kick in, and there's never a cap. And it's not at the same time as your in-network deductible. Your in-net deductible is $5,000. Let's say you reached your 10, maybe it's 9,100. You've reached your max out of pocket in network, and now you go out of network. That's another 10,000. So PPOs, people just think in their head PPOs are good. They hear it from their, from their job, and maybe they did have a good PPO in their job. There's a few that aren't so bad, but if you sell a PPO, they need to understand that. If they go somewhere out of the network because of an emergency, it's going to be covered. But just because you're going to go see the spine specialist in Missouri and you live in Florida and you have a PPO, they're not really going to cover it. Make sure you really look at what that max out of pocket is and deductible for out of network. But people think, oh, it's Blue Cross, and I'm going to go somewhere that's covered by Blue Cross in a different state. It's not contracted. It's not a network. Joseph, the 15 per month. I don't know what that is. I don't know what you're referencing. Sorry. Jill says she likes LACRM 50. Oh, there you go. $15 a month. It doesn't do much, keeps you organized. So there are very inexpensive. Oh, Joe, you're talking about the less annoying, aren't you? So yeah, the less annoying is about 15. There are some pretty inexpensive ones. Agency block can be expensive, especially if you start adding people, but they've got some stuff coming down where the texting will be right through agency block. So then your text will attach to the person. Voicemails and phone calls through agency block automatically attached to the person. They're working on the scope of appointment. So all you have to do is click it, send it to the person. So they do have some automations, and then they are the only one I know of that keeps track of commissions, though Agent CRM, he told me that was his next big project. He's trying to get commissions set up. So it can be expensive, but they are it does have a lot of stuff. HIPAA compliant, those are some of the ones you have to worry about. It's really, now remember, we're not really HIPAA, it's more PII, but yes, make sure your stuff is secure. That's partly why I use Form Doctor to send out my text messages. Form Doctor was created for doctors, for chiropractors and doctors to send out information. So it's completely HIPAA compliant. They have their own security. And it has worked so slick. It's really nice. And then we actually even have uploaded our intake forms to Form Doctor. I did not create it because they were like, oh, for $15 we'll create it. I'm like, yes, please. And it's our intake form, the prescription list, and their income documents that we require for our appointments. And now we can send them to people and they can fill it up on their phone. It's so nice. And it's easier than Adobe because it's on their phone. So I'm not affiliated with them, but I have been really happy with Form Doctor. Will I have a Zoom meeting on Health Sherpa? I can, but Arlene, if you go to my website and look, or not my website, on my Zoom, I actually walk clients right through. It says Health Sherpa. I walk you right through the application. And in my class, I walk you through it too, in much more detail than the client, because I think That's the class that took 2 hours. I broke it into 2 different sessions because there's a lot to it, because I want you to know it inside out, backwards, forward. So if you just want to know how Health Sherpa works in great detail, I would go to the class, because I do walk you through every little thing, little buttons that you probably didn't even notice on Health Sherpa. And I go into much more detail for agents than I do for clients. Is the Walmart opportunity with that FMO only Walmarts that are a state under the federal exchange? Nope, they are there for a state exchange. I was really happy to see that. I've got, in fact, I know 3 agents from different state exchanges that are doing this. That does remind me, if you are based in a state, if you're in a state-based exchange and you would like to be considered an expert for that state, I am looking for experts, want to send out maybe referrals, because I do get some of those, and also to have you maybe help other agents walk through the state exchange websites. Let me know, send me an email back saying what state you are, because I do want to keep track of those states. And hey, if you're the Pennsylvania person, I got one, Rena said, if you're the, I don't know, Colorado, California, let me know, because I am looking for those people who know their state exchanges. How much will the Walmart cost? Nothing, it's free. I need help with ICHRA plan in New York for family, for my family. I would definitely, so if somebody's in New York, Sharon, she's talking about it, you can. ICHRA is a kind of a unique situation, understanding how that works. So if anybody would like to help, you can. Otherwise, the HR person really should be helping with that as well. Take Command is an amazing company that really knows ICHRA, and I've found them to be pretty useful to respond back. And it's Take Command. Awesome, there at North America. Yep. Is there a high level CRM, DFY CRM? There's lots of ones out there. Can you set your own schedule at the Walmart? Absolutely. It's your Walmart. Now, all I would say is be consistent, because people shop Walmart at the same time. So if you're there on Tuesdays from 9 to 5 one day, and then the next Tuesday you're not there, and then the next Tuesday you're showing up at 5, you're going to miss it. So pick your hours, but it's your hours. If you want to do 2 days a week in the morning and 2 days in the week in the afternoon, you can. If you want to show up on Fridays in the evening, it's your hours. So they just say you have to commit to at least 20. In fact, if there's 2 Walmarts in your area and you'll do 20 hours at one and 20 hours at the other, you could do 2 Walmarts if you want, but you have to have you have to work at least 20 hours and just be consistent. Even in the Medicare world, the moment you go out of network, yeah, the max out of pocket is different. It's the rest. So PPOs, people just have it in their head that it's good, but when you explain that deductible difference, it's usually not. Any forms that you would want me to share with you, Virginia or Arlene, send me an email. Don't send it in here, because by the time I close this, I forgot. So send me an email, and yes, I'll be happy to send those intake forms for you. May we ask Form Doctor to personalize? Yep. I actually gave them my actual PDF. I just sent it to them, and they created it. So it was wonderful. So they can do it. I think Allstate has no ACA plans. Allstate doesn't have any ACA. They sell ancillary. They said dental, critical illness, accident. They don't sell any ACA. So Allstate's just saying, hey, look at our dental, look at our accident, look at our identity plans. So you can do any. Anyone can join Marketplace Mastery Group. Yep, it's a great group. I'm in that group. I'm in ACA training, I think. I'm in like 3 now. So a North American Facebook group, I'm happy to invite anybody there. That's an FMO one that is extremely helpful and friendly. And then Marketplace Mastery. Well, thank you for saying my hair is amazing. It changes all the time, as you guys have probably noticed. So it's the top of the hour, so we need to head off. Anybody send me emails, questions. I will get this recording out soon. And thank you again for everybody for joining in. I appreciate all of you so much. And the more I can make our community better to help our clients, the whole community is better. And maybe we won't have as many regulations as Medicare. That's my hope. Or by the time that happens, I'm retired. All right. You guys have a wonderful rest of the week. I will talk to you next week. Thank you very much, everyone. Again, shoot me an email back if you have any other questions. And recording, there we go.